Good afternoon. Today is Wednesday and we are now in the month of May. This is Dr. Scanterbury and I am the medical consultant for Dialysis Patient Educational Center, and this is our monthly Ask the Doctor session, the first Wednesday of the month, and so we are continuing this episode this month. There may be some changes next month, but I appreciate all of you who are joining and are right on time. Thank you, Megan, and it's me all. Hey, I don't know what your name is, but thank you all for joining. Thank you, Nancy, for coming on again. This is Dr. Velma Scanterbury, medical consultant for Dialysis Patient Citizens Educational Center. And as you guys all know, hopefully if you don't know, I am a retired transplant surgeon who is now practicing in the primary care arena. And so my goal is really to move patients along their journey to better health, whether they have high blood pressure, diabetes, chronic kidney disease, because so many people are unaware of kidney disease. Kidney disease is a silent disease, and so many of my patients that I see are already in stage 3 and 4 without even knowing that they're in stage 3 or 4 because there are no symptoms. And I know many of you on here who have gone through this journey. Some people are surprised that they even have kidney disease, not knowing any symptoms or not having been told about it. So I urge you as advocates for on this platform to really let your constituents know, whether it's your book club, whether it's your church community, the fact that kidney disease can be ongoing and that you may not necessarily present any symptoms. Many of us say things like, oh, I just felt a little tired. And I just, as women, we all think that fatigue is just normal because we do so many things. And so it's important as adults to really know your numbers. We talk about know your numbers, going to the doctor, knowing what your blood pressure is and your cholesterol and your blood sugar. But it's also important to know what your kidney function is, and also to make sure that one of the early tests for kidney disease is protein in your urine. And for many children, that's the first sign that would present long before there's anything else detected. And so for kids, whether it's a congenital disease, whether it's onset of things called diseases within children, defects in urination, chronic urinary infection, checking that protein in the urine can be significant, especially when there's no other signs that can tell you that something's wrong with the kidneys. So question in the chat, at what age can a child get a transplant? And can an adult give a kidney from a child's cadaver? And so there are a few kids who are born with congenital kidney disease, maybe a defect in utero in terms of blood flow to the kidneys, in terms of the kidneys descending, ascending up to their normal place from the pelvis. But in those few instances where a child is born, and oftentimes it's known in utero, whether it's going to need issues, whether they will have issues with the kidneys. And so once a child is born, it's important to get them to a size that they can accommodate a kidney transplant. And generally, in most young kids who, if they have poor kidney progress during in utero, they may be small for size, but the goal is to get them and support them through those months that are needed to be able to have an abdomen, and particularly the blood vessels that can accommodate the size of a kidney from an adult, because we generally don't. Kids under 18 cannot consent to donation, so even if they have a sibling who wants to give a kidney, they can't do that. So the kidney to the child can be a cadaver kidney or an adult kidney. But generally for small kids, because kidneys in terms of a deceased donor kidney are so small and are more subject to torsion and more subject to thrombosis, We don't want to give a child a cadaver kidney unless they're of an age to understand that it may or may not work, and that it's a real disappointment to a child. So oftentimes, if the child is getting a cadaver kidney, it usually is of almost certainty that that kidney will work, in the sense of that donor is in the same hospital or has to travel a small area to give to that child receiving it. But we don't generally give a cadaver kidney from a child to another child. Generally, we do an adult kidney to a child because you want that kidney to be adequate to serve that child and for it to filter that child's body, and also to make sure that it can function with some certainty almost immediately, because child doesn't understand that I got a kidney but I still have to be on dialysis. So most nephrologists will give you will not allow for that to happen. And for a child who needs a kidney, generally we want the whole length of their, from sternum to their pubic bone, to be at least 7 or 8 inches, to be able to, well, 7 centimeters, about 7 inches, to be able to open them up, lower abdomen from the xiphoid down, to be able to place that kidney, because you're placing an adult kidney inside the abdomen and using their main vessels, which may be smaller than the vessels of the kidney. So long answer, but generally that kidney to a child is going to be an adult kidney, not generally that child's deceased donor kidneys from children are generally given to an adult. Can a transplant patient get diabetes if their donated kidney was from a living donor or a cadaver kidney that have diabetes? No, the diabetes is just a defect within your own pancreas, generally the pancreas of the person who is the recipient. However, the kidney may coming from, well, first of all, will not take a living donor kidney from someone who has diabetes, because diabetes affects the kidney, and therefore we don't know to what extent, without doing a biopsy on the potential donor, how much that their own diabetes have affected their kidney transplant, get their own kidneys, knowing that they would need both kidneys down the line if their diabetes progressed, because diabetes is a cause of kidney failure. So we're not going to do that. But if it's a deceased donor who have had diabetes, we will biopsy that kidney to make sure that their own diabetes have not affected and caused scarring within the donated kidney before we put it in. So it's usually how long has the donor been diabetic, and are they diabetic changes scarring in the kidney? And generally that biopsy, we want it to be less than 20% of scarring to be able to, and to know that once we transplant it, we don't want diabetes within the recipient who may have to make that kidney worse. So good question. Why does a dialysis patient get a potassium bath? Certainly one of the things that is important that your kidneys cannot filter. We look at things that we need to remove that's important and can cause issues with your heart. So high potassium can cause significant arrhythmias, or can make your heart stop suddenly. So the goal is to try to lower your potassium as much as possible, because we know that in between those days, between dialysis, anything that you eat may raise your potassium higher. So we want to be cautious about not taking in a lot of potassium, because we want to be able to get that. And so your potassium, if you miss dialysis treatments, may go extremely high. And so once it gets over 6, it becomes a danger to your heart. So there are things that go out of whack, and that can lead to significant heart disease, sudden death. That's what happens. And too much potassium in your body can jeopardize the sudden death. So we want to be able to keep that potassium down. The other things it's important to keep down your phosphorus, but most importantly, you don't want to endanger your heart because you will have abnormal rhythm on your EKG with the high potassium. So thank you so much for all you have joined. Remember, we will be having Facebook on the third Wednesday at 4 p.m. as Nancy has put in the chat. Again, I'm Dr. Scanterbury, medical consultant for Dialysis Patient Citizens Educational Center, and I thank you all for being here this afternoon. And I hope wherever you are that the weather is great. We're moving into the spring, and Yolanda is really highlighting and all the amazing DPC patient ambassadors who are out there, boots on the ground, really advocating for dialysis patients and all the issues that come forth. So thank you all for all that you do. And certainly the one thing that someone wrote, how do you view holistic kidney health? Well, certainly there are people, if you're able to do it, the goal is, and I've seen many patients who were in stage 4, even stage 5, kidney failure, delay the onset, or even be able to keep off of dialysis by really doing the holistic approach. And you have to be really careful, make sure the things that you eat not overload your kidney. And so you have to really pay attention to your foods, add those things that will help you filter, do the work that perhaps your kidneys aren't doing well. Keep those foods away that will make your kidney function worse. And so it is definitely, I've seen a few patients really go on for years in stage 5 without using that holistic approach, and even being on a transplant list, but not even needing to get a transplant because they were stabilized to some degree. Granted, you have to take in consideration all the other comorbidities that you may have. If you have underlying heart disease, or you already have atherosclerosis of your blood vessels, or you have obstruction of your ureters or other things that may contribute to your kidney decline, then that your approach may not necessarily be helpful. So it's not necessarily a standalone. And so you have to work with your physician and your care team to understand that you're on the right path and doing your research to get to that point that you're able to avoid those things that are harmful to you, and find those fruits and plants that will really enhance your kidney function and keep you from progressing slowly. But oftentimes kidney disease at that stage, you may be able to slow it down, but not for the majority of people. It may not be successful. If you are at stage 3, 3.5, it may be possible to slow down your progress, stabilize your progress, so that depending on your age and control of your blood pressure, diabetes, even if you don't have those things, then it may be a little bit less of a challenge for you. So thank you for those questions. Again, I appreciate your presence here today. Be sure to put your questions in the chat. Again, I'm here to answer your questions, whether it's related to transplantation, whether it's related to getting on the list, staying healthy as a dialysis patient, avoiding the things that you may see necessary or feel that they're necessary, but are therefore harmful to your own health. So it is important to talk with your healthcare providers, and certainly want to do those things that will keep you on par if you're on the list, making sure you do all those things that are recommended by your transplant center so that you can continue to stay listed without being bumped off the list. Vitamin D supplements. One of the things that I find, even as now doing primary care and family health, is so many people who don't have kidney disease are vitamin D deficient. So many of you may be coming to dialysis with already vitamin D and you have vitamin D deficient. And without vitamin D, you're unable to absorb calcium. And so therefore that leads to more bone issues with poor calcium absorption. And so it becomes even crucial as you become a patient. And I don't want to say it's a must, it all depends on what your levels are. To be able to make sure that your supplements, so you're supplementing with vitamin D to keep your bones healthy and to help with calcium absorption, because you have an issue with the calcium. If it gets too low and not being absorbed, then your phosphorus is going to be high. You get too much phosphorus in your system. You don't want that. So you want to be able to have your calcium, more importantly, and lower your phosphorus, because the two are exchangeable. So make sure, and that's one of the things that's generally added, and we even continue it post-transplant, because as I said, so many people are ordinarily vitamin D deficient, and many of our patients are, let's say the normal level for a woman is 30 to 35, and for a man we want to push them up to 45. We see so many people who have vitamin D levels around 10 or less than 10, and in the general population it takes about 6 months to get that up to a level that is appropriate, and that's just for those who don't have kidney disease. So just imagine what that would be doing to you if you were a kidney patient. Myth or facts, is there such a thing as getting a specific number on a transplant list? No. As it's you, at each person, when they get on the transplant list, you have 6 markers. We call those your DNA markers that we're trying to match to all the possible donors that are out there based on your blood type. So if you can imagine, you have a list of all who are blood type O, those that are blood type A, B, and AB, and their DNA match. So whenever there's a donor, you are competing with, you are looking for a match of the donor's 6 DNA markers to your 6 DNA markers. Generally, there's what we call blanks, so that you can match 5 and still be high on the list because you have a blank and they have a blank. But every time a donor comes down, those 6 numbers are different. It's sort of like playing the lottery. You're not going to have that winning ticket because every day the lottery numbers are different. So every donor is different, and so the shuffling of those at the top will continue to rotate. You may be within the top 6, and as those people in the top 6 who are listed get transplanted, you get to be in the top 4, you get to be in the top 2, and eventually you may then get transplanted if you are up there, because you have to remember it's based on the DNA of the donor. If you happen to share a lot more in common with the donor, suddenly you're going to jump higher up than those who match only 2 points with the donor. So there's no specific number. It's very how you match according to those with you that are on the list, and everyone gets into the pool, and it goes with those who match the most to those who don't match anything at all. And then those who have the most time, so the algorithm is put into the computer, and that's how you would therefore be at the mercy of the algorithm, and time versus blood type versus antibodies versus how much you match, and all those things put together. So thank you for that complicated question. I hope I'm able to answer that within the RAM. And remember, you can still jump everyone who are waiting for time, because you match everything with that donor, even though you may not have as much time, but it all compares. So we call that a perfect match. And so getting on the list, and that perfect match may be in Utah, or it could be in Wisconsin compared to where you are. But there may be 6 other or 10 other people across the nation. If they also have that perfect match, then time then comes into essence as to where those 2 kidneys will go. If so, are you still doing transplant? If so, where I would love if you would do my transplant. No, I gave up my scalpel a few years ago. I'm in Delaware. I do consulting. There is a transplant program here, but I don't think they will let me in the door anymore. But thank you for that. I appreciate your vote of confidence. Sometimes I miss it, but I also love teaching. And so this platform gives me an opportunity to do that. And I love being here, being able to talk to you guys and to educate the community. So I so much appreciate that and appreciate your confidence in me. So thank you so much again. I am Dr. Scanterbury. I'm the medical consultant for Dialysis Patient Citizens Educational Center. And I work with Nancy Scott, who is in the background firing all the questions to me. And so we can keep this conversation going. So I appreciate that very much. Travel. Can you dialyze with a company other than your own? Certainly you would have to do that research if you're traveling in terms of knowing your dialysis numbers and your treatment plan, there will have to be some coordination between your own team and where you're going. For instance, if you're taking a cruise, for instance, you're in dialysis, you certainly can cruise, and there are some cruises that have hemodialysis, or they can send all your PD equipment ahead of you to the cruise line, so you're there and you have all your stuff with you. And so they also have to be some coordination. Obviously, it's not going to be your own, and different cities may have different ones, but if you're on hemo, then you will have to find a place that would accept you and your insurance based on where you're going if you're doing in-center dialysis. But if you're home dialysis, PD, they will work. And as far as the others, you will have to talk with your providers to see how that will work depending on where you're going and what city you're traveling with. I'm sure some of you might have traveled. If you have, please put in the chat what obstacles that you encountered and what suggestions you may have for others who would want to travel. I think cruises are certainly maybe the easiest because you can have those things in your room and not have to lug from hotel to hotel. And also you get to see multiple places on that cruise, depending on your ability to ambulate, whether it's difficult getting off the cruise ship, but it certainly makes for a nice vacation, and the food is right there with you, and there are doctors on board who can take care of you if you run into a glitch, and something to think about. I'm not sure which cruise lines, but there's certainly an opportunity for that to happen. So thank you for that question, and I'm checking to make sure that I answered all the questions. We have a few minutes left, so if there's any of you who would like to pose a question, please let me know. One of the things we know, moving forward, is that there may be some changes in this timing, or trying to decide where we go. We would like a bigger audience, so certainly if we want you to invite your friends who are on dialysis, even those who have caretakers, those who are thinking about, even if they're not on dialysis and on the transplant list, it can also be helpful for those who are waiting for a transplant but have not reached dialysis yet, and can remember that you can be listed for a transplant as long as your EGFR or your kidney function is 20% or less, but you don't have to be on dialysis to get on the transplant list. And remember, if you're doing well with your stage 5 less than 20% and feel that you're functioning, your side effects are minimal, you may be just a little bit tired, but you're working and you have a enjoyable life, then every kidney that comes down the pipeline may not necessarily be for you, because certainly with every transplant that's offered to you, you want to make sure that it's going to offer you benefits compared to where you are there. If you're waiting for a deceased donor, remember that all deceased donor kidneys will not work right away. There are some that we take and we remove knowing such that there is cardiac death before, and we know that there's going to be a delay in that kidney waking up. Those can generally be good kidneys, provided the donor is young and healthy and doesn't have underlying diabetes or hypertension or other things that would impact how long that kidney lasts. Those are things to take into consideration. How long have that kidney traveled, and what's the likelihood that it's going to offer you better outcome than what you are enjoying right now. Remembering that if you are not on dialysis, if your blood pressure is high and you have a lot of symptoms and you're fatigued, then you may need a kidney urgently, or you may need to be on dialysis. If you're avoiding dialysis, it's not a good thing, because you want to make sure that you're not holding out and that you are not putting your heart and your body in jeopardy because you're trying to avoid dialysis, but you're accumulating a lot of fluid, which is jeopardizing your heart. So if there's a recommendation, please make sure that you follow through. This is Mental Health Awareness Month. Thank you, Nancy, for reminding me. You recommend therapy for depressed renal patients. Most certainly, when you think about depression, it's just as much of a disease condition as having diabetes. You're not making enough insulin. You may not be making enough dopamine. The stigma around mental health is going away. I offer it may just be that you need some help. You may not necessarily need medication, but having someone to talk to, being able to make you feel better about yourself, understand the situation in which you're in, which could be situation of depression, getting you to understand that none of this is your fault. Diseases will come along, talking through that therapy. We have therapists right here in our office, because oftentimes many people do not think they need a therapist until they're spending a lot of time talking through the issues. And so there's no stigma there. I have a therapist. I recommend a therapist. So there's no, sometimes we just, when I don't see my therapist, I'm punching my boxing bag so I can take up my frustration. So I don't have to punch people. But yes, we definitely need to make sure that we're taking care of ourselves mentally. Plan ahead is vital. Always have a backup plan when you're traveling. Most importantly, if you're in-center cruising, cruising is difficult. However, if you do have a dialysis, they do have a dialysis cruise for patients on dialysis. Definitely, I'm not sure how many are available as compared to prior to the pandemic. I've been able to travel and have some materials shipped to my destination. I'm able to schedule my treatments around my travel plans. Thank you so much for that. You definitely need to plan ahead, having a backup plan in order to know what may or may not happen. What would you do in case something doesn't? Your supplies don't arrive in time. I was on a cruise when a patient has sleep apnea. They brought their bag, but they forgot a main component of this sleep apparatus. So whenever we were in port, we had to run around trying to find some place to purchase supplies. So you want to really think about all the things you need to have before you get on your vacation. This year, plan for next year, plan for 6 months ahead. Make sure everyone, if you're planning to go abroad sometime in the next year or two, make sure your passport's up to date. If you don't have a passport and you think about getting one, please go ahead and get that initiated. It is so very important. Yes, UTIs can cause kidney disease, chronic reflux into your kidneys. Sometimes we think it's bladder related, but if you have incompetent valves between your bladder and your ureters, you can have chronic urinary tract infections. We see this often in young people who will slowly cause scarring in your kidneys. So definitely want to get those treated. And if they're recurrent, this is when you need to see the specialist to figure out why your urinary tract infections keep coming back. Do you have a stone? Is there nidus for that? Lots of good questions today. Thank you all so much. Sorry I'm rushing through some of these questions, but it's 1 p.m. and some of us have appointments. And I am so glad all of you could be here this afternoon. Be blessed. Enjoy the spring as it's about to be upon us. And thank you all for joining. Check out dialysisatsea.com for those of you who may be thinking about cruising. God bless and have a wonderful afternoon. Thank you so much.